Hi everybody, it's Dr. Lori Dover from the Two Chiros, and as always we have Dr. Biot Jordan behind the camera today. I'm going to talk about tennis elbow. What Dr. Biot and I do is we usually look in the last couple of weeks before we do our videos and say what have a lot of people been coming in to ask us about, and it has been tennis elbow lately. So tennis elbow is obviously an elbow issue, and it's this part of the arm over here. Now just as a little bit of FYI information, tennis elbow is when the outside of the elbow gets sore. Golfer's elbow is the inside of the elbow in here, but tennis elbow is a lot more prevalent. You'll see it a lot more. Now what is tennis elbow? These muscles in your forearm, these ones right here that you can, the meaty ones right there, they all come up and they attach to that bone right there on the outside of your elbow. If you use these muscles a lot, overuse, those muscles, as they attach to that bone, they pull and tug and tug and tug on that attachment site. And what can happen is you can get little tiny microscopic tears, inflammation, irritation, where the tendons of these muscles attach to that bone right there. And what kind of repetitive injuries? Well, obviously tennis is where the name comes from, but I've seen it in carpenters, plumbers, people who are raking. I've seen it in people who've decided to do spring cleaning, and they're constantly doing something that is repetitive use of these muscles. Now, I don't know if you'll see it in the camera, Jordan can let me know, but you can watch up through here. If I grip, see how that muscle, does that move a little bit?
Yeah, it does.
Or if I rotate my arm like this, or I extend my wrist like that, you can see those muscles are being used. So imagine if you do this hundreds and hundreds of times during the day. This muscle pulls, 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 and that bone right there will end up getting sore. Now the proper name for tennis elbow is lateral epicondylitis. Not that it means anything, but lateral to you. Lateral is outside. The condyle is that bone right there, the epicondyle of the elbow, and itis is inflammation. So lateral epicondylitis, we'll call it tennis elbow. So what I'm going to do is go through some things you can do sort of for self-care at home. And obviously if some of these things don't work, then you come in and you see one of us chiropractors, you see a physio, you see somebody. One of the first things I tell people to do is if this is really sore, and as a little more information too, a lot of people have the soreness here, but this soreness can go down the arm, it can go up the arm, you can sometimes even see swelling there too. So obviously if it's inflammation, irritation of tissue, put some ice on it. Bag of frozen peas, gel pack, whatever works for you. Usually icing is anywhere from 10 to 20 minutes. I like to leave about an hour in between your icing, so if you want to try that a couple of times a day, and just sit at your kitchen table, whatever, and put some ice over that, and see if that helps you a little bit too to try to get the inflammation down. The other thing I'll tell people to do is you want to try to stretch these muscles out so that they're not tugging on that attachment site. So easy stretches. First one is to let your arm, I'll just sort of come this way. Does that work a little bit? Just let your arm sort of lock your elbow out, go straight. Let your hand fall down like that. And then with your other hand, go above your knuckles and just sort of pull down like that. And you can see that is stretching up the forearm. Now some people, they're so sore, they can't almost lock the elbow out and have it straight. So just bend it at your side a little bit. And if this is easier for you, and again, just above the elbow, take your other hand and just stretch it like that. Now what you want to do too is try it with straight on, and then turn your arm out a little bit, your hand out a little bit, and sort of hold it like that too. And like any stretch, hold it, I don't know what, you usually 15, 30 seconds?
Yeah.
Jordan? Yeah. So upwards of 30 seconds. So hold it for about 30 seconds, and then, let it go, just move it around a little bit, and again, maybe try out this way, like that. Now, I will have people stretch this side for a couple of times, then turn your hand over and stretch the inside just to balance it out. Most people do this and go, I can't believe how tight this is. So just again, sort of on your knuckles here, pull your hand down like that, twist it one way slightly, one way the other way slightly, and stretch the inside just to balance it out a little bit. So that is to ice it, to try some stretching. Now another thing you can do is some self-massage. Now, some props. Mm-hmm. I like either using a ball, this is like a ball hockey ball, or a golf ball. Get your arm on a table, something like that, and take the ball. This is where you're going to find your sore, is all in through this meaty part right here. So you can take the ball and with your other hand, just sort of, you can either grip it like this or flat hand like that. I sort of like gripping it. And just take the ball and move it around like that, all through that muscle, all down the forearm. The thing with this is if you can relax this a bit and it's not so tight, it won't tug as much at the attachment site. You can use a ball like this. Some people prefer a golf ball. And again, that one's going to go, isn't it? No. Okay, it's in there. I thought that was going to roll off. And again, you can come in through here and just sort of self-massage it like that. Now, another thing you might see online if you Google this is they recommend to self-massage and do what they call cross-frictioning, so going across the fibers. These muscles, if you take 2 or 3 fingers, I sort of like 2, and go back and forth like that, you'll find that they will sort of snap and crunch underneath. That's okay. What you're doing is you're getting across the fibers, and you are, again, just sort of self-massaging that. I would say most of my patients, between the icing and the stretching and that self-massage, will find it really, it helps quite a bit. Now, one of the other things you'll see is doing some exercises, because you also, once this starts to feel a little better and isn't quite as hot, you want to try to use the muscle, exercise the muscle. So I have a weight here, but you can even start with a soup can if you want. I've had some of my patients that will literally grab like a light hammer. That works too. So what you want to do is, again, maybe at a table. This one's, I guess, a good height, but you want to be at some sort of a table and put your elbow on it and just let your arm hang over the edge like that. If you just want to start with a fist without a weight and just sort of lift your arm up like that and then let it go. And then lift up like that and then let it go. And that just sort of warms up and starts to use that muscle. When you find, if you find it's not sore and you say do a couple of sets of 10 and you think that wasn't too bad, it's not sore, I'm fine with that, then add a weight like a soup can or like a weight. And again, let your arm hang off the edge like that and then just come up and hold it and back down like that. Now another exercise too that you'll see is having the weight like this and just sort of rotating your arm very gently in and out and in and out like that. If these exercises, the weighted ones, aggravate you, do not do them, okay? It means the muscle is not ready to take any weight at all. Usually by doing those things, that will help. If you find that it doesn't, you can certainly come in and see one of us. What we would do as chiropractors, a lot of people think, oh, that chiropractors are just back people. But we can do acupuncture. Jordan does acupuncture up along the arm. I have a laser that I can put on that can help with healing and pain. Sometimes we'll refer the person off to the physiotherapist because maybe it's not just elbow. Maybe there's an issue with the way you use your wrist or the way you use your shoulder that is aggravating the elbow. So you want someone like a physiotherapist to look and help you with some exercises and some different range of motion and stuff like that. But there's definitely something you can do for tennis elbow. So do not suffer with it. Just give us a call. Any one of us can help you at any time. That's what we're here for. And as always, if you have any questions, concerns, comments, just reach out, and I hope you have a really good day. Thank you.